Conversation online and be a part of WCTC's real-time talk. Like 1450 WCTC on Facebook and follow us on Twitter at 1450 WCTC. Jersey Central with Bert Barron.
Think we could listen to the radio or something?
On the new Talk Radio 1450 WCTC.
It always sounds like a good idea to me. 7:08, welcome to hour number 2 of Jersey Central on the new Talk Radio WCTC, the voice of Central Jersey. It's Bert Barron. Good morning to you. We're inside the Forge Jeweler studio today, and good to have you here. We'll do our contest a little bit later on in this 7 o'clock hour, the tickets to see Steve Forbes at the State Theater. We'll give you a chance to win those. Well, September is Prostate Cancer Awareness Month, and joining me now on the Jersey Central Newsmaker Hotline, one of the leading radiation oncologists with ProCure Proton Therapy Center in Somerset, serves patients throughout New Jersey, around the country, and also attracts patients from overseas. So let's get some information from our good friend, Dr. Henry Tsai, who is back with us this morning. Dr. Tsai, good morning. It's Bert Barron. How are you today?
Good morning, Bert. I'm doing great. Thanks so much for having me.
Yeah, good to have you back with us. And with September being Prostate Cancer Awareness Month, I can't think of any better to have on the show than to talk about it than you. When it comes to treating prostate cancer, once you get that diagnosis, there's a lot of treatments that are available out there. And what are some of the things that you offer there at ProCure?
Absolutely. You know, when a man gets diagnosed with prostate cancer, I think the first thing to realize is that it's time to start getting information and educating oneself about what the different options are. They can vary from as much as surgery and radiation to watching and active surveillance, but we offer at ProCure a specialized type of radiation treatment called proton therapy.
And what I've always heard about that is this: it's sort of a pinpoint, very accurate way to treat this without sort of there's no collateral damage when it comes to it, I guess is what I'm trying to say, right?
Right. I think the important thing to understand about proton therapy is that it's a very precise type of radiation treatment. It utilizes proton beams as opposed to conventional X-rays to deliver the radiation energy to the target, which is, the tumor or the cancer. And why that's important is that protons interact very differently in the body than X-rays. Whereas X-rays go all the way through the body, the proton beam stops at a specific distance, so we can actually control how far that beam goes in the body and thereby get the radiation to the target, but really minimize the amount of radiation that gets delivered to the normal healthy tissues around that prostate, for example.
Yeah, so I would just guess that just the difference between using the protons versus the X-rays, just the health benefits and the side effects are a little bit different and reduced as well, right?
That's right. When we use a proton plan, when we use proton beam to deliver radiation treatments, we can see that significant portions of the surrounding tissues get spared unnecessary radiation treatment. That certainly is where the risk of toxicity can happen. Yeah,
it's amazing over the years that ProCure has been open in Somerset, Dr. Tsai. We've had people come here, we've had patients come here, and they've they've walked us through the process. They talked about how remarkable it is and how they feel like they got a new lease on life as a result of going to ProCure. And I'm sure you've seen that with so many people with the number of years that ProCure has been open in Somerset.
Yes, right, Bert. It's been really gratifying for us and rewarding for us to see all these patients. As you alluded to, we've been open for about 4.5, almost 5 years now. Mm-hmm. And as you and I discussed recently, we had just treated over 2,000 patients. And so over that time, we have seen patients come in from all around the world, all around the area to get proton therapy. And every time somebody finishes treatment, we have a little graduation ceremony that allows us to celebrate the completion of the treatment. It's just a great time for patients to celebrate and be proud of what they've done. To put themselves through a journey through cancer treatment is no small feat. Yeah,
I'm guessing everyone that visits ProCure, Dr. Tsai, it's sort of a customized approach where no two people are treated exactly the same, I would think.
Yes, Bert, that's absolutely the way medicine is nowadays, that every patient, even with the same diagnosis, has to be treated in an individual manner. And every patient is different with respect to resources, to the social situation, to the cancer itself. And we have learned that every cancer requires a customized treatment plan, which is what we do with proton therapy. Each patient who comes in who's felt to be an appropriate candidate for proton therapy, we look at all the features of the cancer, their other health problems, and decide what is the best treatment for this patient. How do we customize the treatment to fit this patient and make sure that they get the best outcome possible?
Was there a time in our history, Dr. Tsai, where a diagnosis of prostate cancer meant the worst no matter what, and we've kind of progressed to this point that, there's tremendous hope for people now that receive that diagnosis?
Yes, and certainly as awareness increases and things like Prostate Cancer Awareness Month have been around for a long time now, I think more and more people are aware of screening tests such as the PSA test, and we are detecting prostate cancer at much earlier stages. Whereas in the old days, patients would only know they had prostate cancer if they had some really concerning symptom. Now, many of our patients don't have any symptoms at all and are able to pick up their cancers earlier and have very good, careful conversations with their doctors about what is the best approach to deal with these cancers.
For somebody like myself, Dr. Tsai, there's no prostate cancer in my family. I have no genetics or hereditary history with that. Is 50 still kind of the magic number for a guy like me?
Well, there's no question that that so-called magic number varies and evolves with time. As you've alluded to, the family history and genetics of it are certainly important considerations. But every patient, has different medical issues, and I think it's really important that a man speak to their doctor about what the pros and cons of doing prostate cancer screening are, what the potential treatment options are. It's all about education, which is why I think Prostate Cancer Awareness Month is so important.
I hit the magic number coming up in 2 years, Dr. Tsai. So just so that just so that I got 2 years to go until it's going to be something that I'm going to have to think about. So where can someone go to get some more information about ProCure Proton Therapy Center?
Sure, there are any number of ways. With our Proton Center, one can access the website, www.procure.com. We also have informal sessions called Welcome Wednesdays. Actually, every Wednesday this month, we're doing an informal session at our center for people to come find out about proton therapy. It happens at noontime, so we welcome people to come learn about proton therapy there. But the website really is a great portal for resources and information about proton therapy.
Good stuff, as always, Dr. Tsai. And thank you for your time this morning and for being with us here. And just keep up the great work at ProCure, okay?
Thank you, Bert. Thank you so much.
All right, Dr. Tsai, thank you. All right, Dr. Henry Tsai, my guest.